Has your right leg been numb since 2011? I knew about surgery in 2018, but the numbness couldn't be relieved.
I couldn't get rid of the numbness, you know. It was like I couldn't stand up without holding onto something or being caught.
It appears that you took the train for the first time in a span of 6 months. Yes, it was my round trip, but I'm glad that I made the decision to go this time. It turned out to be a good decision.
This person, in 2011. So I started experiencing numbness in the soles of my feet, and then after a few years, it started spreading to my arms from my neck. And gradually, my hand movements also became impaired, which is what they call a motor disability. So, after that, gradually the strength in my legs started to decline, and finally it became difficult to walk. So, in 2018, I had a cervical spine surgery. I had a surgery, the numbness in my hand has improved a bit, but it seems that since then, the strength in my legs has gradually weakened, and the organ dysfunction in my hand that I mentioned earlier has also worsened. So I came to this clinic. So this individual, received a direct injection of liver cells from the lumbar spine. I have administered it a total of 4 times today, with each administration occurring once every 3 months. Generally speaking, when it comes to the field of spinal cord stem cell therapy, the use of intravenous strips is quite common in Japan. However, the direct injection of stem cells into the spinal cord remains a highly uncommon treatment method in the country. 2nd, 3rd, 4th, 5th, 6th, there is a spinal nerve emerging from behind the 7 vertebrae. If it is protruding slightly unevenly from the front, it could be indicative of a hernia or some other related condition. Additionally, there is also a certain amount of pressure exerted from the back region. There are some places that have become a bit narrow, and when it becomes like this, you may experience numbness in your hands or feet, a decrease in strength, or the speech impediment I mentioned earlier. It becomes difficult to use your hands, and things like that start to happen. After that, it's been about 5 years since the surgery, but in this MRI, the black thing you see here is a screw that fixes the cervical spine. Spinal cord behind it is here. On the other hand, I think that the jagged edges have been smoothed out and the passageway is flowing nicely, but upon closer inspection, this area of the spinal cord here is slightly whitened. This is probably where the spinal cord has gradually changed and the damage has progressed, even from before the surgery to after the surgery. Whether it's in the cervical spine or the lumbar spine, of course. Even in the spinal cord of the chest, which is called the thoracic vertebrae, the place where it is inserted is already from the lumbar vertebrae, and it is inserted towards the lumbar vertebrae, and when it enters the spinal cord. This white part is cerebrospinal fluid. However, the cerebrospinal fluid keeps moving around the brain and back here every day, so when you put stem cells into that cerebrospinal fluid, it will reach all the way up end. Stem cells are great. I'll go to the damaged area, maybe around here where it's bad. I believe stem cells have accumulated in this white, injured region. Typical conditions comprise cervical hernia, lumbar hernia, cervical spondylotic myelopathy, and lumbar intervertebral foramen stenosis. Numerous individuals are affected by symptoms like numbness and weakness in their hands. Well, the situation is deteriorating progressively. In many instances, there are occurrences where symptoms such as a gradual decrease in strength or the onset of numbness that was not initially present begin to manifest, or muscle weakness that was not initially present starts to manifest. In such situations, if an individual undergoes surgery once, they can halt the progression of these symptoms. This is the current state of the medical field in Japan. In the health checkup, they couldn't do it, but by directly putting liver cells into the spinal cord, not through N4, I was able to get rid of numbness and gain muscle, and I had those kinds of symptoms.
こんにちは。はい、どうぞお気をつけてください。はい。こちらのスリッパにお履き替えお願いします。よかったらおかけになってくださいね。はい。
Today, I was struck for the 4th time, and I learned that the impact was quite significant following the 3rd occurrence. The only change I experienced was an improvement in my leg strength, but it was a straightforward and effortless process. It felt like something happened, but I can provide more details in a concise format if you'd like. Initially, on the return journey, my legs experienced a noticeable decrease in weight, and I was able to walk with increased speed. It was a wonderful feeling, especially after returning. Despite not being in good condition for a prolonged period, my legs genuinely became lighter. I am curious if I received a phone call during that moment when I made the call. The sensation of my legs becoming lighter brought me immense joy. I am wondering if there are any other changes that have occurred.
Yeah, I suppose my legs have gained strength. It feels like I'm putting power into each step, you know?
I see. In the future, as you build up more muscle strength, there's a good chance you'll be able to walk briskly without a cane. When you squat down and stand up, you might go like, ah. It is unexpectedly simple to maintain an upright posture, you know. Well, it's definitely easier to stand up now, although there's still a bit of numbness. But overall, there's a slight relief in the tension from the buttocks to the toes, you know?
I used to feel like I couldn't stand up unless I was caught, but now I can stand up on my own, even though it's not for a long time. I can be independent. The number of times I go to the bathroom has decreased quite a bit, hasn't it? It has decreased. So, in the past, I used to go for approximately 10 to 15 minutes and do it a total of 4 times per day, but now I have returned to my previous lifestyle that I had before.
Despite it being late at night, I heard recently that something happened. You've been going multiple times, causing sleep deprivation, but now you can sleep soundly. No more middle of the night visits, you're doing well. You know, it feels like I just peed, you know? That kind of feeling like the urine went out and came back. It's been a solid 6 months since I last took a train. Yeah, that's right. Before, I was just taking a taxi back and forth. This time, I'm glad we decided to go. It's great that we kept going and going. Yeah, believe in strength.
I sort of gained confidence.
Yeah, I guess so. You know, since 2011, my right leg has been numb, and since around 2014, I've been experiencing numbness from my neck to my arm, making my hand a little difficult to use, you know? In 2018, I had surgery, but the numbness didn't go away, and I still have some trouble using my hand, you know? How about that? As for my hand, there are some small things, you know? I can't do it with my left hand.
Yes, the right hand is affirmative. You have the ability to grab coins and press buttons, correct? Wasn't it already possible prior to receiving this Kansai part?
Couldn't attend this time, but Kansai region seems to share the sentiment. Any improvement in the situation?
There has been a slight improvement in my right hand, and now I am able to button up if I take breaks. I have no recollection of the frequency, but suddenly, I am capable of doing it. This progress is significant, isn't it? Especially considering the condition of my hand, I mean. Yeah, that's right.
It's been since 2018 that I had the surgery, you know. Dang, we were going backwards. I mean, my hands, you know. It's also progressing with difficulty, right? So, I was running with all my might, but I ended up falling on my butt and breaking my left bone. I had to have surgery, you know. Well, I mean, I think I was able to walk much more energetically before I developed it in 2011, but how much have you recovered now? In summary, the person inside has been struggling from the start and has survived until around level 3 or 4, despite initially being at level 7. Additionally, I'm feeling numb this time, not experiencing the usual refreshing sensation. However, if I could eliminate that, it would be much easier, you know? Yeah, that's right. Today was the 4th time, so I thought I'd try it again. After a month, I wonder how it will feel. There was still an effect, but it's a hassle. How will you handle it? Today, I'll rest with medicine. From tomorrow, I'll be active, you know? So, I was watching that dad, and he said he doesn't go out much, so I think it's natural that he's become more reserved. But sometimes, he goes out together, climbs the stairs, and even holds hands. Please understand, okay? Well, I'll call it a day. Thanks, I'll catch you later.
ありがとうございました。
気をつけてまた報告教えてね。
わかりました。
はい。
はい。
をつけて。
気をつけてお帰りください。
はい、気をつけて。